Hi guys, welcome back to the channel. This is your host Dr.Smita Singh, and it's been quite some time since we did a video. So, hi, long time no see, as we say it usually. Today, what we are going to talk about is a lot of people were asking me about what exactly does an RMO do when you finish your internship, when you finish your degree, when you pass your FMGE exam, when you're done with all the documentation, you have your registration with you, you have your permanent registration with you. Then what? Then comes the real life. Then is the real deal, which is something different than what we imagine. In a good way or a bad way, both. I think you can mix it up. Nothing is 100% good, nothing is 100% bad, so it's a mix of both, yin and yang. How you see in videos and how you see in Grey's Anatomy, life is not like that. Especially in India, life is not like that. So what does an RMO do? What do you do as an RMO is basically your job is to, if you are appointed, depends on what department you are. So I have worked in a surgical department, and I have also worked in medicine department for a year around. So surgical department, I did a urology surgical department. There the work is quite different than the work I do in the medical department, like the medicine department of medicine. So depending on that, which department you are joining, where you are getting recruited, which section you are getting recruited, your job will be basically dependent on that. But the basic things would be, first you'll have to do your duty doctor notes. Duty doctor notes is your daily rounds of the patient, whichever patient you have been assigned, department or patient, whatever, in which you would have to state, like how you write your duty doctor notes is, I'll give you an example. You'll start with seen by Dr. Smita Singh, duty doctor notes, so and so, general consciousness, pain score, then the diagnosis. What is the diagnosis? Suppose in the medicine department we are having acute febrile illness patient, so we'll write acute febrile illness patient. Or someone is just admitted to the ward with a chief complaint of high grade fever, so we put them under pyrexia, under evaluation. So you will further evaluate, and you'll keep on putting the notes day by day, and you'll keep on changing the diagnosis day by day as whatever the reports say. So basically what you do is put the diagnosis, put the issue. Active issues are very important in your daily notes. You'll have to do that. Like, this is a good format of writing your daily notes. You can write your daily notes in a lot of ways, but over the time I've realized that this is a good way to write it. In diagnosis, you can write whatever the things are going on, which we already know or which is already in evaluation. Second one, in the active issues, you can write what is today's problem. Suppose the person is having constipation, so you can write constipation. Suppose the patient is low in potassium, so you can write hypokalemia. Likewise, depends on what the patient is going through. Also, the next step will be on examination. You have to do the rounds of your own patients and then see what they need. Like, what do you need to examine? Suppose someone is a post-op patient, and you have kept the patient NPO for quite some time, and then you want to see if you can start the liquid diet or the soft diet or not. So in that case, on examination, you'll have to hear for bowel sounds, you have to see the bowel distension, other things. So it depends on examination what you'll see, but the major basic things what you write is CNS, your cardiovascular system, your nervous system, CNS well oriented or not, things like that. Chest, if it's clear or not, creps are present or not, wheezing is there or not. Suppose in a patient of LRTI, you'll have to write those things, whether occasional creps are heard or not. So that is what you have to do. And then you'll move further to advice portion, in which your advice portion should include the directions you'll be giving directly to your nurses, the nurses who are in charge of those patients. Also including the treatment. If you're adding something, just write the add-on medications, whichever you're adding. If your hospital has a rule to write whole treatment, like ongoing treatment, then you'll be asked to write the whole treatment. These days, NABH, according to NABH regulations, you'll have to write at least once a day. The treatment chart is written in a duty doctor notes, which is written in capital bold letters. You're not allowed to write TDS, BD, OD. You have to write 24 hourly, 8 hourly, 12 hourly, likewise. So these are some things you have to keep in mind. Basically, this is how, basically a duty doctor's primary thing is managing the patients, doing the primary rounds, making it easy for the consultant to come and take the rounds. Because once the consultant comes, you